Hello, Barbara. Can you please tell me what is your role at Mesoestetic?
I'm a trainer, a doctor, a medical trainer.
Mm-hmm. Okay, so you work every day with Mesoestetic fillers for intimate?
Yeah, I do every single day.
So there are two types, right? 20 and 25. What are the differences?
The 21 is for hydration, and we use it basically in vagina mucosa. And the 25 is to increase volume, and we use it in labia majora.
Okay, and is there any age restrictions from what age we can start using these fillers?
No. Of course, every woman could need this type of treatment at every age because, for example, when we have a baby and we feel dryness, we can try this type of treatment in our mucosa in order not to have pain with our relationships. And of course, if we are under chemotherapy or radiotherapy, we also can use this type of treatments.
Mm-hmm. So the fillers are used for aesthetic reasons and also medical, right? What are the differences?
Okay, this type of treatments, as you say, we use it for functional reasons and for aesthetic reasons. So the main difference is the desire of the patient. We could have younger women that desires a bigger volume in their labia majora, so because of aesthetic reasons, and we can have older women that needs some hydratations because they feel pain in the sexual intercourse. Depends on the patient's desire and depends on their objectives.
Mm-hmm. And is the procedure painful? Do you use any anesthetic?
Yeah, we use anesthesia, whether we use it via cream or maybe we inject anesthesia, but basically the procedure, it is not that painful, okay? Mm-hmm. Maybe they can feel any source of pain, but it has to be really, really soft.
And for how long is the effect?
Depends on the patient and depends on the dryness that they have, or even how they care themselves, because we are not used to care our genital area. We are not to use cream in our genital area, which is something that we should do even when we are young. So it depends on the patient, but around 12 months, 18 months.
Mm-hmm. And does an active sexual life triggers how long the filler can last?
No, basically, sexual intercourse, what makes is that helps you regenerating the genital area because it increases the blood volume in your pelvis. So it helps you with hydration. So as much as sexual intercourse you have, the better you will feel.
Okay, so it's even better to have it more.
Of course.
Okay. Where can a specialist learn to even do these procedures for the patients?
Well, I always recommend professionals to at least come to one of the training that we do here in Mesoestetic. But there are, in certain countries, there are postgraduate degrees or a master where you can be trained to perform this type of procedures.
Mm-hmm. Does the fillers need to be removed over time?
Not unless you have any complications. Mm-hmm. So as it happens in the face, for example, or in the rest of the body, unless you have an aesthetic complication or even a vascular complication that in vulva is not that often, then you need to remove it.
So the fillers cannot migrate to other areas?
Well, if you place the filler in the correct area, there's no much amount of fillers that can migrate. Yes. But of course, as in any other fillers, you can lose product.
Mm-hmm. Okay, and one more product from Mesoestetic is the hydrogel. Yeah. Okay, what's the difference? What would you suggest more to do the filler or do the gel?
Well, it is complementary because with the filler, you will feel much better within 2 weeks, and you will feel, I'm talking about the hydration filler. So you will feel like really comfortable within two weeks. And what I always suggest my patient is to make a complementary treatment, whether with the hydration gel, which is like our hydration cream, the one that we use for face. So that increase the results and maybe prolong the effects.
Okay, and does a woman can use the gel at home, or does she need like a supervising from a doctor?
The gel can be used at home by as normally, okay, because it's hyaluronic acid gel. There's no any side effects apart from if you have any allergies for the product, so they can do it at home with any doubts.
And can the gel cure some infections, like for example, yeast infection?
No. No. I mean, the gel was developed for hydrates, okay? Of course, when you have a better hydration in your vagina mucosa, then your pH will be better. So probably you would have less infections. Then the tissue will be better. So you would have less pain with the sexual intercourse, and you won't feel any dryness at all. But the gel is basically for hydrates and for maintain the normal tissue of your genital area.
Okay, and how many women actually nowadays use these fillers? How many know about them? Is it popular in Spain?
Well, it is getting popular every day because women, I think they are searching for something else, and they are more aware of their genital care area, okay? Because they think that as in the rest of the body, I mean, if you start taking care of the genital area before, then you will have a better aging. So they are trying to take care much better in the genital area. So I think that women are increasing their interest in this type of treatments.
And I think you are helping them a lot, because not everyone knows about these. And I also didn't know about even the option like this. So thank you so much. Thank you for your answers. And yes, thank you for working at Mesoestetic.
Thank you very much.
Thanks.